very much. It gives me great pleasure to introduce Dr. Joel Moskowitz, and I want to thank him for all the work that he's done. His blog provides really useful information. He's going to talk with you today about something that very few people have appreciated. You know, none of us can follow all the literature. It's very complex and there's a lot to it, but the fact is the best studies that have ever been done have been produced out of Sweden by Leonard Hardell. And very recently, Dr. Hardell released a study that Joel Moskowitz is going to talk about today that I think really is a very important contribution to this literature, because it shows that 25 years of use of a cell phone increases the risk of brain tumors substantially. I want to remind you not only to keep your phones on airplane mode or off, so that we're not distracted in the room, and that those people who are sensitive to the exposure will be spared. So thank you for that. Dr. Moskowitz.
Thank you and good afternoon. So I'm going to start off this talk basically at the point where in 2011 the International Agency for the Research on Cancer of the World Health Organization declared radio frequency energy possibly carcinogenic in humans. And then I'm going to talk about some of the recent research, particularly the work by Dr. Hardell on wireless phone use and brain tumor risk in humans. And the reason I'm saying wireless phone use is because it includes cordless phone use as well as cell phone use. And many of the earlier studies, with the exception of Hardell's research group, have ignored the exposures that are coming from the cordless phone, which are very similar to the cell phone. And this contributes to an underestimate of risk in these studies. I'm also going to look at brain cancer trends over time in several countries and discuss why the absence of a trend is not proof of safety. And finally, I'm going to discuss some of the implications in terms of public policies that my colleagues and I have come up with based upon the research. The International Agency for Research on Cancer basically is the health agency that is considered the gold standard in terms of considering carcinogenicity of various agents. And they have a whole set of standards for classification, and there's different levels of classification. And in 2011, they convened 31 experts from around the world to look at the issue of radio frequency energy, and the panel largely focused on the effects of microwave radiation, and especially for the human studies, they were looking largely at the studies looking at the effects of cell phone radiation. And the determination was made at the end of this meeting that this form of energy should be considered possibly carcinogenic in humans. This created quite a stir around the world. The industry got its experts to try to dismiss these findings by framing them in a way that sort of trivialized them. But if you look at the whole list of possibly carcinogenic agents, and there's numbering something like 200 agents, many of these are serious-sounding chemicals that we just need more information on before they can be declared as definitely carcinogenic. Things that go into pesticides and other kinds of toxic chemicals. This year, WHO finally produced the monograph that came out of this meeting, and it actually updates some of the research that was considered and provides additional research that was considered back in 2011. This got almost no media coverage anywhere in the world, and yet it's a major product coming out of the World Health Organization, this monograph, and it is available on the web, and I believe I have links to this on my website and a press release about it. The industry and some of the industry-affiliated scientists like to distract us from the case control studies, which most of the research falls into, to focus on the cohort studies, because in theory, cohort studies are supposed to be somewhat stronger than the case control studies. But unfortunately, the two large case control studies conducted on cell phone radiation have been very, very weak. The one study, the Danish Cohort study, essentially misclassified the cell phone users, many of the cell phone users, because it was linking data from a cancer registry with data from a population registry with very limited data from the cell phone industry. And they actually had no self-report data from the individual subjects. And as a result of this process, the estimates are tens of thousands or hundreds of thousands of people who were business cell phone users. The phones were in the name of the business, not in the name of the individuals. They ended up, so what that meant was the comparison group basically had many of these, the heaviest users, the people who had gotten their cell phones from their business was paying for the cell phone time. They ended up in the control group in this study. And as a result, what happens is, in the early years of looking at the data, it appeared like there was actually a protective effect, and finally that effect sort of disappeared. But the study is pretty much worthless, in our opinion. We reviewed the literature in 2009 and published a paper in the Journal of Clinical Oncology. We actually just totally dismissed the Danish Cohort study, but to this day there are many people that say, well, this is definitive evidence that there's no effect of cell phone radiation. More recently, the Million Woman study, and I think there's actually more like 700,000 in this study, so you think big numbers, oh, it must be good. But here too, this was a study designed to look at hormone replacement therapy. They had very limited questions on cell phone use, so they did not assess the amount of cell phone use, nor did they assess cordless phone use. And if we were thinking, let's say, and as an analogy, we were studying the effects of alcohol use on liver disease, well, you wouldn't just look at when is the first time somebody used alcohol, or have they used it once a week for the past 6 months and expect to see a strong relationship with whether they get cirrhosis of the liver. Similarly, you wouldn't ignore beer because it's lower, it has less alcohol, less ethyl alcohol in it, less concentration of alcohol in it, and just look at wine and liquor consumption, distilled spirits consumption. That would be a huge mistake. Well, most of the studies, with the exception of the Hardell group, have totally ignored the cordless phone use because it was lower intensity. And I have some email correspondence with Dr. Hardell recently saying, why did they do this? And he says, I don't really understand. I went to the first planning meeting of this 13-nation study, and I told them, you have to measure this. This is important. We're finding in our research cordless phone use has to be assessed and looked at when you do these studies. My colleague and I argued strongly this point and a number of other points, and what happened was they just didn't invite us back to any more of the planning meetings. And here is essentially the leading researcher in the world, and they wouldn't listen to him. And reports I've had from people who've been covering this industry have basically said, well, one of the reasons was he is an oncologist, and an epidemiologist didn't want to listen to an oncologist. But he works with other professionals, and I'm sure he consults with, and probably has on his staff, epidemiologists as well as biostatisticians. So it's kind of a shame. At any rate, let me update you on the latest study. The point when the Interphone study or the point when the WHO looked at the studies, basically we had evidence of a twofold risk in glioma, which is a very serious brain tumor. It's a form of brain cancer. It accounts for about 80% of the brain cancers. The glioma is the cells, the supporting cells for the neurons in the brain. And we had evidence of acoustic neuroma, which is a nerve from the brain, or from the ear to the brain. This is generally a non-malignant tumor. And the evidence appeared to be, among those who had used the cell phone for about 10 years or more, about a twofold risk of each of these cancers, or each of these tumors. In this latest study, we have now follow-up data or data on people who've used phones, both cordless and cell phones, for up to 25 or more years. And what you're finding is that the relative risks, the risks of glioma, are now over threefold, and the risks of acoustic neuroma for 20 or more years are over fourfold. The amount of use is also very important, such that if you have more than 2,380 hours, let's say 40 minutes roughly a day over a 10-year period, you have about a 2.5-fold risk. And there is a dose-response relationship between the amount of wireless phone use and the likelihood of glioma. This, by the way, was published in a series of papers, and it received virtually no attention anywhere in the media, particularly English language media. I was only able to find one Swedish language article published in Sweden of this major finding, which looks at the long-term effects of using either cordless or cell phones. In one of the earlier Hardell studies, and the numbers are small, but this is informative because we have very little data on the risks for starting to use the phones at a young age. And what Hardell and his research team found in this study was that if one began using a mobile phone before the age of 20, the risks were much greater. The confidence intervals around these estimates are somewhat large because of the small number of cases, but this is indicative of the potential risk. There is one case control study that's recently published on children, which I'm not going to cover today, which actually, if you read it carefully, found evidence of harm, but the primary authors of the paper try to dismiss it, as in many of the other papers, the researchers are motivated to sort of dismiss any harmful effects that they find and downplay the risks. And oftentimes they'll point to either the cohort studies or to the tumor registry data to try to argue why you should just ignore the harmful effects that they are finding. So I find that rather odd, but not surprising. So what is the problem with pointing to the tumor registry data or the cancer registry data and saying, well, we're not seeing it here, so obviously it must not be happening? Well, there's a bunch of problems with trying to interpret these kinds of trend data. First, there's a very long lag between an exposure and the detection or diagnosis of a tumor. And we're talking about many decades, up to 4 decades. So you won't see the effect right away necessarily in the tumor registry. Also, the early years of adoption of the cell phone, the amount of use was very light. In fact, in the 13-nation trial, the average user in their lifetime used less than 100 hours for their entire life. That's the cumulative use for their entire life, which is accomplished in this country in less than a year. So it's not surprising that you're not seeing effects on the bulk of the population then in the tumor registry. Another problem is the actual way the tumor registry data are collected, which in many countries there's a huge lag between when a tumor is diagnosed and when it's reported to the registry, and in many instances in some countries the tumors don't even get reported into the registry. Plus, if you do see changes in the registry data, changes in like the slope or in terms of the incidence of brain cancer, you can always try to interpret them in terms of other factors, such as better detection. So the industry and their affiliated scientists, some of whom have very little expertise or experience doing this kind of work, nonetheless will point to in these directions, such as the tumor registry data or these large cohort studies, and use them to try to dismiss the evidence of effects. All right. Basically, this is looking at the uptake of cell phone subscriptions in the U.S., and now there are more subscriptions than there are people. Roughly 90% of adults now have now have phones, and 78% of teens, 12 to 17 years of age, have cell phones. But a lot of this has occurred in recent years, so you would not expect to see necessarily in the tumor registry data increased incidence of brain cancer. And in fact, overall, when you look at the tumor registry data, at least as of 2007, as published by the National Cancer Institute, you don't see the effect. However, there is an increasing incidence of brain tumors of the frontal lobe in young adults 20 to 29 years of age, which we have no good explanation for at this point. However, there may be some hypothetical explanations, which I don't have the time to go into. There is evidence, however, from some of the early adopting countries in terms of the cell phone of increased brain cancer incidence. Norway, for example, we see an increase over time, which seems to be accelerating in the more recent years. Finland, we also see a similar pattern. Denmark also is showing an increase in serious brain tumors in recent years, the past decade. I don't have that slide here. So basically, we know at the very least cell phone radiation and cordless phone radiation is a possible carcinogen, and many experts are now beginning to believe it's a probable or even a definite carcinogen. That both of these forms of phone use increase glioma and acoustic neuroma risk. This risk increases with the more you use the cell phone. It also increases with the longer duration of use. And it's largely found on the side of the head where people mostly hold their cell phone. The ipsilateral risk is greatest. We need to know more about the effects on children or teens. We expect that those effects will be much larger. We need to know more for people who are using the phones a lot more than in earlier years. We need to know more about lifetime risk. Right now, the National Cancer Institute estimates that one's lifetime risk for brain cancer is roughly 1 in 200. If we're tripling that risk, then your risk may be 1 in 65. And the risk estimates may be even higher for those who start using cell phones as children. So we need to know more about other newer wireless technologies like fourth generation LTE. There's one study to date that shows changes in brain activity after a 30-minute exposure to an LTE signal. That's the only study I've found so far in the literature, and that was recently published and received no media attention anywhere in the world. I have a press release on that on my website. And we need to continue, obviously, to monitor tumor incidence. So the scientific community is caught in a crossfire. On the one hand, we have people who are affected by these risks and have become activists who are arguing, let's ban all of this technology. And on the other hand, we have an industry that's arguing, basically, it's not at all harmful. And they're sending their experts around the world arguing there's no evidence whatsoever. And many government officials are just simply confused and, as a result, fail to act on this issue. Science is basically a slow, cumulative process, and ideally it's a self-correcting system. But when you have most of the researchers largely dependent on industry to get their research funded and support their graduate students, it tends to undermine that whole enterprise. And as a result, the scientists become even more conservative, and when they do find evidence of harm in their research, they tend to downplay it. And it just creates more and more confusion rather than building toward some consensus. And so what we're seeing is a split in the research community now where some of the investigators are arguing for precautionary health warnings and others are saying, oh no, we have to wait for 20 to 30-year cohort studies to be completed. Well, this is completely ridiculous. From the standpoint of public policy, from the standpoint of public health, we can't afford to do this and sacrifice the future generations just to wait to see if the cancer registry data shows increases over time. We've seen this happen with other phenomena like tobacco, and we're still paying a huge toll for our inactivity in regulating. So, I can skip that. All right. let's just cut to the chase. The federal government, though, has been negligent, not only in terms of regulating this activity, it has also been negligent with regard to funding the needed research. We have not participated in the major trials to date. So our government is as complicit, probably more complicit than just about any other government in the world in terms of not looking at what the risks are and how to stop these risks. Because we are arguing for precaution. We're not arguing banning anything. We want safer technology. We want a fully informed public. We want to change the social norms around how people use these devices such that they will respect these devices as potentially harmful as well as recognizing that they are extremely valuable and use them in a safer fashion and not have to worry so much. So what my colleagues and I have been recommending for several years now is to strengthen the safety standards, improve the testing procedures, mandate safer technology. We also need federal research funding that is completely independent of industry, so there is no apparent or real conflicts of interest, and so we can develop the appropriate standards that actually reduce harm, potentials for harm, and enable the industry to produce much safer products. Although there are a lot of patents for safer technology, which we can talk to later, that the industry is not using. Also, we're arguing that the public be fully informed about the health risks and be provided with safe use recommendations. And finally, we're suggesting a modest nickel-a-month fee on each cell phone to support a major initiative for research, education, and training on electromagnetic radiation and health. Thank you.